Well, for a very long time, we've been told that aspirin could prevent heart attacks, but today, that advice was tweaked a bit.
Well, Dr. Micah Eimer is a cardiologist and medical director of the Northwestern Medicine Glenview Outpatient Center. Thanks for joining us. I love your name, by the way.
Thank you. I get a lot of compliments on it.
Oh, good. Well, first of all, why the change of the information here? We've been told for years you're supposed to take baby aspirin to prevent cardiovascular disease, but now all of a sudden they've changed course.
Yeah, I think the first thing I want to say is that it really depends on who you're talking about. So the current new recommendations are in respect to patients that do not have coronary artery disease or have had a stroke. So primary prevention. The role of aspirin in secondary prevention, meaning people that have had heart attacks or strokes in the past, still definitely a benefit to aspirin. So this is just in patients that do not have those things. And I think what we're seeing is that a more careful analysis, longer follow-up, and weighing of the risks and benefits show that the answer is it depends. In certain patients, it makes sense to take aspirin. In certain other patients, it may not. In other words, the risks may outweigh the benefits.
I feel like, sometimes this information gets confusing to people. Like one day they're told, eat an apple and you'll be fine. And the next day they hear, well, I don't know, the apple might have some sort of chemical on it. How do you see, as guidance changes over time, people's ability to either absorb it or even trust it change?
Yeah, it's difficult. And no doubt we got a number of phone calls today to the office saying, oh my God, I just saw this, should I stop my aspirin? And I think this is where, the patient and the provider are really a team. And you need to reach out to your provider and say, does this apply to me? And that's really the only way to sort these things out. It's very difficult in this day and age for patients to be able to discern, am I in the high-risk group that they're talking about? Does this really apply to me? So I think always reach out to your healthcare team and let them help you figure out if this new data applies to you.
But it is enough to scare people. I mean, the new data coming out saying it could cause bleeding in the brain, the stomach, and the intestines. And it also says that if you're over 60, that's when you should put a brake on that. Is that still apply?
Yeah, I think there's definitely some truth to that. But again, keep in mind, these recommendations are meant for broad swaths of the population, whereas in any individual, it may or may not be true. So for example, if you're over 60, but you're very high risk for a heart attack or stroke, aspirin may still make sense. I think what the new guidelines are saying, though, that as a general rule, just because you're 60 doesn't mean you'll benefit from taking aspirin.
Not necessarily that there's a danger?
No, so there is danger for sure. There is also benefit. And I think what we're seeing here is we're doing more of a weighing of the risks and benefits and finding where those sweet spots are for patients to take aspirin. It also emphasizes the fact that patients have to know what their individual risk is. And that, of course, you need the help of a healthcare team. So I think it's difficult to make absolute decisions based on these guidelines, but I think it does say that when we weigh the risks and benefits, there are patients who will benefit, there are patients who won't benefit, and you need the individual sort of looking at to figure out which one of those patients you are.
Okay, Dr. Micah Eimer, the only time I can ever put doctor in front of Micah. Thank you very much for that good information. Be safe, be well.
My pleasure. Take care.
Thanks, Doctor.